Assalamu alaikum students. Today we are going to study the disease asthma. So asthma is actually a lung disease that causes some breathing problems within your lungs, and it's a long-term disease and usually common among children, but adults can have asthma too. People can have chronic asthma or they can have an acute asthma attack as well. So what happens is asthma is that there is some people are allergic to any kind of allergen. For instance, some people are allergic to pollen grains, some are allergic to wool, some are allergic to dust particles. So such people, if they inhale such things, if they inhale the allergen, and that allergen is going to cause some reactions in the body. So in asthma, there is contraction of the smooth muscles of the bronchioles. Now in your lungs there are bronchioles and their smooth muscles will be contracting when this asthma attack comes. So they contract, and this contraction of the bronchioles is also known as bronchospasm. And the lumen, this contraction can result in the narrowing of the lumen of the bronchioles, which will obviously increase the air resistance, because air cannot flow through very narrow passages and it will face resistance, it will face difficulty for the air to pass through such narrow passages because the bronchioles are constricted as their smooth muscles are contracting. So this contraction will occur in response to some allergen. As I already told you, that allergen can be anything that a person is allergic to: pollen grains, woolen, dust particles. It can be anything, any kind of food. So when such allergen is inhaled by the person, then it enters your bronchioles, and there it triggers a reaction or a series of reactions. Because these allergens, these are not actually harmful. Pollen grains are not harmful to your body, but allergen is any substance that is harmless, but your body recognizes it as a foreign antigen and reacts against it. So that is what an allergen is. So when such allergen enters your airways, they are going to cause a series of reactions, and those reactions can be that histamine would be released and other chemicals would be released. And how would they be released is that when the allergen comes in contact with the mucosa of the bronchioles, it is going to allow the formation of IgE antibodies. IgE antibodies are actually present on the membranes of mast cells, which are WBCs. Mast cells are kind of white blood cells, and obviously they are involved in our immune response. So allergic responses also come under the heading of immune response. So these mast cells have IgE antibodies on their membranes, and they are going to release those IgE antibodies, which are going to react with the allergen that is entered in your airways, for instance the pollen grains or the dust particles, and that is going to cause a reaction, and that reaction is known as allergic reactions. So allergic reactions, although that allergen is not harmful to your body, but your body considers it to be harmful because it's a foreign antigen. So it's going to release histamine, which is actually a chemical that is released by mast cells, obviously, because IgE antibodies are present on the mast cell membranes. So this histamine is released by the mast cells in response to an allergen, and they are going to cause constriction of the bronchiolar muscles. In this case, in the case of asthma, they are going to cause constriction of the bronchiolar muscles. But otherwise, if histamine is released in another kind of allergic substance that is related to your skin, then skin allergies will be like itching or a rash will develop. But in case of asthma, there's no development of any kind of rash, but instead there is going to be bronchiolar constriction. And there would be another substance is the slow reacting substance of anaphylaxis. Then there is bradykinin, and the reaction is also going to involve eosinophil chemotactic factor, which is going to attract the eosinophils, which are again a type of WBCs, white blood cells, and these are going to come into the site of allergic reaction, and they are going to these cells, they are also involved in the response of the body to allergic reactions. So all of these chemical substances, they are going to cause edema in the bronchiolar walls. That is because they are producing inflammation, they are reacting against that allergen, so they are going to produce inflammation, and that inflammatory fluid is going to accumulate in the walls, and that is going to cause edema in the walls of the bronchiole in which the allergen has come. Obviously not all the bronchioles would be edematous, because the allergen has come only to a single localized area in the lung, and only that and only the bronchioles of that region of the lung, they will be edematous. And then there is the mucosa swelling because of inflammation. Again, there will be more mucus released, and that is another thing is there would be bronchiola constriction, as histamine is involved in bronchiolar constriction. Slow reacting substance of anaphylaxis is also involved in constriction, along with bradykinin. So all of these things, they are going to they are going to reduce the size of the bronchioles, sorry. They're going to reduce the size of the bronchioles, and when the lumen of the bronchiole narrows, there is increased resistance to air flow, and the passage of air is going to be difficult, and the person faces difficulty in breathing. And another classical symptom of this asthma is that there is going to be a wheezing sound, a whistling kind of sound when a person is breathing, and that is because the narrowing lumen of the bronchiole is going to cause the whistling sound. Just like when we are trying to whistle, we narrow the lumen of our mouth, so that's how a whistle is formed. So just like that, because of the narrowing of the bronchioles, a whistling sound or a wheezing sound is going to be observed. Other symptoms are obviously coughing, because especially at night, because there is going to be a lot of mucus accumulated inside your bronchioles. There is going to be chest tightness, and you're going to face difficulty breathing, and there is going to be shortness of breath, and the person will be trying to hyperventilate. The person will be trying to take short breaths, but quickly the breathing rate will increase. That person will be taking short and rapid breaths. There will be difficulty talking, obviously, because when a person, there is decreased ventilation, the person cannot take in cannot ventilate the air in his or her lungs because of the difficulty of breathing, and that is going to cause low oxygen levels in your blood, because you cannot take in a lot of air, a lot of oxygen in your lungs. So if hypoxia occurs, then that is obviously going to cause fatigue in your body. You're going to feel you're going to feel fatigued, you're going to feel weak, you cannot work properly. There is going to be a wheezing sound, as we discussed previously, and there is going to be another thing is that the bronchiolar diameter is more reduced during expiration than inspiration, because during expiration your chest cavity, your thoracic cage, it is going to decrease in size, and it is going to compress the bronchioles. It's going to, during expiration, the thoracic cage decreases in size just to decrease the volume inside the pulmonary cavity, and when the volume decreases, the pressure increases and the air flows out. So if the during expiration the thoracic cage or the pulmonary cavity is going to decrease in size, it is going to compress the bronchioles, and when they are compressed, already their lumen is narrowed as compared to previously when there was no asthma. So already their lumen is narrowed due to mucus formation and the bronchiolar constriction and edema as well, and when expiration further reduces the volume of the chest case and compresses the bronchioles, so they are going to collapse. Bronchiolar collapse is going to occur. So during expiration, it is more difficult to bring the air out of your lungs as compared to inspiration, that is taking in air into your lungs. So in asthma, the main thing is that expiration becomes difficult rather than inspiration, because bronchiolar collapse occurs during expiration, and hence there is great difficulty in expiring the air. So the these are all the symptoms based on which a doctor might diagnose that this is a classical case of asthma, but other measurements also have to be taken. For instance, tests should be performed, and there would be reduced maximum expiratory rate. Now, the maximum expiratory rate is the rate at which the person can expel out air at the maximum speed. Obviously, if a person does not have any difficulty in inspiration and expiration, if that person is healthy, then his maximum speed of expiration would be high, his maximum expiratory rate would be high. But if a person with asthma cannot has difficulty in mainly expiration, then there is reduced maximum expiratory rate, the rate at which he is taking out the air from his lungs out into the atmosphere, that is reduced. And there would be reduced timed expiratory volume, also known as the forced expiratory volume 1, which is the amount of air that a person can force from his lungs in 1 second. And usually what happens is this FEV1 or forced expiratory volume 1 is maximum in the first second. When you're going to expel the air out during the first second, a healthy lung is able to expel most of the air out. Approx 80% of the air would be expelled in the first second. So his forced expiratory volume in the first second, or the FEV1, is going to be 80% in a healthy lung, or more than that. But if a person has difficulty in expiring the air out, so the amount of air that he or she is expiring during the first second, that is going to decrease drastically, because obviously there is airway obstruction. So that is going to decrease to 20% in a really severe case. So FEV1 is going to decrease to 20%. And obviously, if a person cannot ventilate his or her lungs properly, there is going to be less exchange of oxygen and carbon dioxide from the lungs to the atmosphere. So the partial pressure of oxygen in your capillaries, in your blood, it's going to decrease, because not enough oxygen is coming inside from the atmosphere. And partial pressure of carbon dioxide in your blood is going to increase, because carbon dioxide is not being efficiently exchanged with the environment due to really difficulty in the expiration. So it cannot be taken out, the carbon dioxide cannot be washed away from your lungs, so its concentration, its partial pressure in your blood, it increases. Another clinical measurement is that there is going to be the PEFR, which is the peak expiratory flow rate, already discussed as the maximum expiratory rate, that is going to decrease. So because the person cannot expire air at a really rapid rate, so the PEFR is going to decrease to less than 50%. Normally it's 80 to 100%, as we discussed that in the first second, the forced expiratory volume is going to be 80%. So it's going to decrease less than 50%, and in really severe cases it is going to be 20% or less than that, not less than that, but the least is 20% in a really severe case. And ABGs are going to show, ABGs, arterial blood gases. So arterial blood gas analysis is going to show that there is less oxygen in the blood and there is high carbon dioxide in the blood. And the respiratory rate is also going to increase, because the person is trying to hyperventilate, as there is going to be hypercapnia, increased partial pressure of carbon dioxide. So the person is going to hyperventilate, and his respiratory rate is going to increase to more than 25 breaths per minute. So those are the clinical measurements that a person will experience, that a doctor can find out in this classical case of asthma. I hope you've understood. Yeah. Well, thank you.